Hi, I'm Dr. Tash. Welcome to Dr. Tash TV. In today's episode, I'll be talking about a form of pain relief called a TENS machine. I'll be talking to Heba Shaheed, who's a women's pelvic floor physiotherapist, a women's health coach, and the founder of the Pelvic Expert. Today we welcome Heba Shaheed to Dr. Tash TV. Heba's going to talk to us about the TENS machine. My first question to Heba, welcome,
Thank you.
is what does TENS stand for?
TENS stands for transcutaneous electrical nerve stimulation, which basically means that it's a form of electrotherapy that is applied across the skin.
So Heba, how does it actually relieve pain?
So what it does is it stimulates your sensory nervous system, and it kind of blocks the pain signals from your brain through your nerves to the tissues. We know that pain is something that is controlled by the central nervous system, and the central nervous system is your brain, your nerves, and down to your tissues. So if we block the signals going from your brain through the nerves to the tissues, then we can release the pain or reduce the pain and also encourage relaxation.
So in what conditions or in what situations would a pelvic floor physiotherapist use a TENS machine?
So there's a lot of different situations that you can use it in. In the pelvic pain sort of field, it's really useful for pelvic pain, for sexual pain, for conditions like vulvodynia as well.
What's that?
Vulvodynia. Vulvodynia is basically a type of nerve pain where you feel pain along the vulva or just outside your vaginal area.
So the vulva is that area, exactly, yeah.
Where the vaginal area is, and just around it you might feel some pain. Some people feel it when they're sitting or when they're after intercourse, and it can be quite an annoying burning sort of sensation.
Okay.
So it can also be used in period pain. So a lot of women who have endometriosis or just general period pain find it quite useful. And there's also some other applications, not in the pain sort of field, but more so for other women's health issues like bladder urgency, incontinence of your bladder and your bowel, and it's even used in labour, so in pregnancy to help with labour.
In pregnancy, in labour?
Yeah,
okay.
Yeah, definitely. So there's a lot of different applications, but it is most commonly known for pain, any type of pain.
Great. How can the TENS machine be used specifically for women?
So there's a few different ways that you can use it. So you can, if you purchase your own TENS machine,
And at this point I'll pull out the one I have.
they usually come with a set of electrodes. So maybe we'll open up this one.
Yeah.
So we just whip out the little device, and it usually has a few little electrodes, and the electrodes kind of plug into the device. Usually in the pack they'll have some electrodes, and they can look quite different in different sort of machines. So usually they're square shaped. In these ones they look like they're triangle shaped. And in some cases we even use a vaginal probe. So if we're trying to target women who have, for example, vulvodynia or sexual pain or urgency of their bladder, then we would whip out that vaginal probe. But generally for generalized pain, you would use these square-shaped electrodes, which Tash is taking out right now.
Yeah, so in this pack it's interesting, you have these shapes here, and then Heba's going to open up that kit. There's a few different
And
shapes.
this one
actually.
here as well.
Yeah. This kit has
Some little circle
round ones.
and some triangular ones.
Okay. So I suppose it depends on what part of the body you're wanting to work on.
Exactly.
Yeah.
So depending on which part of the body you would apply the different shaped electrodes, and usually in the actual kit it will tell you which one to use. So if we're going to use them for pelvic pain or for period pain,
So say if I've got bad period pain every month.
Yeah, so it depends on where you want to place the electrodes. So you can use the bigger ones if you're going to target around your back, or you can use even these small little ones and place them around your pelvic area. So maybe if you can stand up, I can show everybody where we can put them. So for period pain, usually where I would put them is if you just turn on side on, we would find the little dimples in the lower back, and we would put a couple of electrodes on each of those dimples. That might be enough. In other situations, we would put 2 electrodes on the 2 dimples and then 2 electrodes along the bones at the front of your pelvis. So then you'd have 4 points that would help to bring down any overactivity of the nerves in that area and ultimately help you with your period pain or your pelvic pain.
So you'd be using these little round ones?
Yeah, so I would use these little round ones. So I would generally go with some small little ones, or these big ones if we're trying to get them onto the pelvis and the back.
So who shouldn't use the TENS machine?
So basically anyone who has a pacemaker or defibrillator of some sort, that might be a bit risky, so that's contraindicated. Some people say that women who are in the first 3 months of pregnancy shouldn't be using it. There is a bit of a difference of opinion when it comes to that. If you have any open wounds, you wouldn't put the electrodes over your open wounds. If you have any dermatological conditions like dermatitis or psoriasis, then you wouldn't put the electrodes over that. But apart from that, generally anyone can use the TENS machine, which is pretty cool.
And is it best that you don't moisturize or put any creams over the areas in which you're going to apply that?
Yeah, definitely. Don't put anything on. If you like, and this is something we do in our clinic, we just use a bit of alcohol wipe just to cleanse the area, and then apply, let it dry, and then apply the electrodes onto the skin. Yeah, because any type of lotions won't allow it to conduct as well.
Okay. Very handy information. So what are the advantages of using a TENS machine?
So it is quite useful for relieving pain. It's portable, so you can tuck it away in your pocket or under your shirt. It's pretty easy to use. So once you've done it the first few times, it's really easy. Just plug it in, put it on, turn it on, and done. They can be quite cheap, but the price does range.
What price range is there that you look at?
So we're looking at anywhere from $60 up to $300.
Oh, wow.
So yeah, it just depends on the brand, where it's made, and how big it is as well. So if it's smaller, it's more likely to be a bit cheaper. Yeah, so those are kind of the main advantages. And the other thing is you don't need any medications. So
yeah, drug-free.
Drug-free.
Yeah, we like that. And how about disadvantages to using it?
So the disadvantages, I guess, is that it doesn't work in everybody. So, in some women, they don't find it really useful. And I think that actually comes down to how much they know about their pain and their pain experience. And what I actually find is that the more they actually understand why they're experiencing pain, the more effective the TENS machine can be.
I noticed you've got a book there about pelvic pain. Is that something you'd recommend patients?
So this book here, it's called Why Pelvic Pain Hurts. I'm a really big proponent of understanding pain. And the more you understand pain, and the evidence and research all shows this, is that the more you understand pain, the less pain you'll have. Okay, so the more that we understand the role of the brain and the nervous system in our pain experience, the less pain we will actually experience. Because essentially, pain is a message that is driven by the central nervous system, but it is something that we experience. Not that it's all in your head, but it is definitely a component of the pain that we need to address the brain's understanding of it.
Wow, and that's a book you recommend?
This is definitely a book I recommend, especially because it's all about pelvic pain. So it actually explains everything from the point of view of somebody experiencing pelvic pain. And it's all types of pelvic pain, whether it's period pain, endometriosis, interstitial cystitis, pudendal neuralgia, any type of pelvic pain, it will explain it and help you to understand from the point of view of your brain, your nervous system, what's happening in your body to help you ultimately reduce your pain. And from a personal experience, whenever I feel my pain is coming up, I come in, I read this book, and the next day my pain is significantly reduced.
That says a lot.
And I didn't write this book, but
yeah, but we
it's
love
pretty cool book.
We love promoting books that help our patients, and obviously that's one of them.
Yeah, I give it to all of my pelvic pain patients, or I read it to all of my pelvic floor patients.
So, in your experience, Heba, which patients do you think TENS works best in?
So the TENS machine definitely works best with women who are concurrently having other forms of therapy done. So definitely a woman who's seeing a women's health physiotherapist / pelvic floor physiotherapist or has seen one. A woman who has done pain neurophysiology education, so she's been taught by the physiotherapist or by a pain educator about her pain experience, so that she understands why it is that she's experiencing pain. And yeah, so definitely just somebody who's actually working in a holistic sort of approach. So targeting other things like maybe her nutrition, so trying to avoid foods that are inflammatory to her pain, and perhaps even some psychotherapeutic methods as well.
I love the way you mentioned food, and I think a lot of people don't realise that there are foods that aggravate conditions. So thanks for mentioning that.
Yeah, definitely. And one last thing is probably as well, not probably, definitely women who are engaged in some form of exercise. So whether it's yoga, because yoga is really, really helpful for women who have pain, or walking on a regular basis, or a gym-based program, but anything that's going to help her nervous system have a better experience.
Excellent. Thank you so much, Heba.
You're welcome.
Amazing. Thank you for watching today's episode of Dr. Tash TV. I really enjoyed making this video with Heba today. If you found it useful, please share it with the world. Subscribe to my YouTube channel so you don't miss out on any future videos. And until the next video, be well.